All right, guys, this is going to be my episode on, well, maybe I'll do more on this, but this will be my first episode on neuroborreliosis. That's the manifestation of borreliosis when it gets to your central nervous system. I'm going to talk about all things that is responsible for. And I'm going to go over a lot. So I want to first say that all these symptoms that I'm going to talk about, I had most of them at one point or another, many simultaneously. And it's kind of like part of my life that I try to forget about because it was really terrible. And so I think I may have like subconsciously like blacked some of it out. But also my memory was super impaired too. So that's part of the whole issue as well. But it was definitely traumatic. So if I stopped to talk about like every single symptom, I would probably be here like all day. So I might just stop to talk about like one or two, and then any of them that are like particularly interesting, I'll probably do a separate video on that just because of how like out there some of this stuff is. So first I'm going to read you guys an article, and this article was actually written back in 2020 by one of the doctors who I am currently seeing. He's one of three on my like team of doctors, and someone shared this with me the other day. I had no idea he was putting out articles like this, but so this is by Robert Bransfield and a couple others who co-authored it. And I'm just going to read it real quick. So it says, many late-stage chronic Lyme disease clinical findings are neuropsychiatric. A total clinical assessment is critical in diagnosis, especially since controversy surrounds the reliability of laboratory testing. The clinical findings of 100 Lyme disease patients with chronic neuropsychiatric symptoms were entered into a database. The prevalence of each clinical finding, pre-infection and post-infection, was compared and calculated within the 95% confidence interval. Patients had minimal symptoms pre-infection, but a high post-infection prevalence of a broad spectrum of acquired multi-system symptoms. These findings included impairments of attention span, memory, processing, executive functioning, emotional functioning, behavior, psychiatric symptoms, vegetative functioning, neurological, musculoskeletal, cardiovascular, upper respiratory, dental, pulmonary, gastrointestinal, genitourinary, and other symptoms. The most prevalent symptoms include sustained attention impairments, brain fog, unfocused concentration, joint symptoms, distraction by frustration, depression, working memory impairments, decreased school or job performance, recent memory impairments, difficulty prioritizing multiple tasks, fatigue, non-restorative sleep, multitasking difficulties, sudden mood swings, hypersomnia, mental apathy, decreased social functioning, insomnia, tingling, word finding difficulty, name retrieval, temperature fluctuations, light sensitivity, and disfluent speech. The average patient had 5 symptoms pre-infection and 82 post-infection. 82, guys. Pattern recognition is critical in making a diagnosis. This study was used to develop 3 clinical assessment forms. So, down here it says, Robert Bransfield has been an expert witness in cases involving neuropsychiatric manifestations, alcohol abuse, drug abuse, violence, and homicides involving Lyme borreliosis patients. So this is like a big mental health problem, and also it leads to violence. And I'll get into that in a whole other video. But like, it's actually crazy what this stuff can do. I'm gonna read one more article really quickly. Try not to bore you guys. Okay, this one says the study. This is authored by some other researchers. This study examined the relationship between neuropsychiatric and psychological symptoms in patients with Lyme borreliosis. We collected data from an experimental group of 252 Lyme disease patients and a control group of 267 healthy individuals. The quality of life and sleep, attention and memory performance were assessed in both groups. Additionally, we investigated depressive symptoms in patients with Lyme disease to examine whether duration of the disease had an influence on the severity of symptoms. Okay, I'm going to skip a lot and get to the bottom where this is the point I want to make. On average, patients visited almost 8 physicians to obtain a diagnosis. On average, that means that 7 doctors don't know what the hell they're talking about when it comes to this, or know anything about it. And if you are in the middle of this trying to figure it out, and you go to 7 doctors who misdiagnose you or tell you like they don't know or that nothing's wrong, a lot of people by like the 3rd or 4th doctor will just be like, okay, I guess the doctor knows best. So it also says 8 years on average passed between the tick bite and the diagnosis. Less than half of the sample, 46%, received their diagnosis within the first 5 years after the development of symptoms. It becomes clear that Lyme disease is often diagnosed very late. It appears that people suffering from Lyme disease have significantly lower quality of life and sleep, show cognitive impairments when it comes to attention and memory, and the study showed that only 3.1% of Lyme patients were satisfied with their lives. So, people aren't getting treatment early enough in this disease because doctors don't know enough. So the illness is prolonged and just the infection's getting bigger and bigger and affecting more systems in their body before they even like find out about it and handle it the correct way. So that's going to be a huge problem for people because the disease can become chronic and lifelong if you let it go that long. If you catch it early, you can often treat it and get rid of it. But that's the major problem with this disease, is that physicians don't know what to look for or how to make a clinical diagnosis or anything like that. So I'm going to say tick-borne illnesses that persist long enough to invade the central nervous system can cause severe psychiatric states on their own. Lyme, in particular, can hijack the immune system by way of pro-inflammatory cytokines. Pay attention to this. Killing neurons, which then dump the excitatory neurotransmitter glutamate. Glutamate has many roles, but it's vital for memory, mood regulation, and cognition. When glutamate is dumped, adjacent neurons become extremely active and work themselves to death in a brain-injuring chain reaction. We call this excitotoxicity, okay? So this is a key mechanism underlying several neurodegenerative diseases. You're going to want to go on Google and go to images and type in microglial activation. Now there's 2 types. The first type is the activation will be neuroprotective and anti-inflammatory, and that's how it's supposed to work and how like a healthy brain will be acting. And then in the case of like certain viruses and bacteria or other pathogens or disease, the microglial activation will become pro-inflammatory, killing neurons because of the excitotoxicity, creating a whole big chain reaction. So that's how this whole thing works. You get your neurons killed basically by your own brain. Okay, I'm going to read one article very quickly about what they call ocular Lyme borreliosis, and it's all Lyme, but this is what happens when part of your brain is affected that interprets like what your eyes are seeing, so your vision, and I'll talk about my experience with that a little bit. Let's see. It says 4 patients presented with neuro-ophthalmologic disorder. 5 had external ocular inflammation. 10 patients had uveitis, and 1 had branch retinal vein occlusion. 1 patient developed episcleritis, and one patient developed Abdusson's palsy within 2 months of the infection incident. In the remaining 14 patients in whom the time of infection was traced, the ocular manifestations appeared in a late stage of Lyme borreliosis. 2 patients with neuro-ophthalmologic disorder and 1 with external ocular inflammation experienced severe photophobia. That's going to be like extreme sensitivity to light. I had this pretty badly. Whereas the main reported symptoms of the patients with uveitis was decreased visual acuity, 4 patients with external ocular disease, and 1 with a neuro-ophthalmologic disorder experienced severe periodic ocular or facial pain. Retinal vasculitis developed in 7 patients with uveitis. So I'm going to mention real quick some things that I was dealing with when I had this one really bad. The light sensitivity was so extreme that my eyes were like permanently squinted in just like regular daylight, like all the time. So this kind of like hurt I'm doing it right now to kind of remember. This like hurt my face because I was squinting so much that it just became like sore. But also, if I stopped squinting, the light would hit my eyes and cause like so much pain that it was like unbearable. So I had to squint all the time. That's what it was, unless I was wearing like sunglasses. But for instance, like I would be at the skate park dealing with this and like trying to skateboard, like light would hit like a rail or like a ledge, and the ledges were made of like recycled plastic, and it would reflect so brightly that I was like blind. Like if I looked at it, it would blind me, and I would just have to like stand there with like my eyes closed for like 10 seconds, sometimes more, until like I was able to like see again. It was absolutely wild. So I had that, pain, double vision, blurriness, and I had what they call visual snow, which I can only describe as what you would see like if you turned a TV on and went to a channel where there was nothing besides like a static kind of like fuzziness, and you know exactly what I'm talking about. So my vision was like that. Not black and white, it would be in color, but it would just be like all these little, everything looks like it's made of like a bunch of little fuzzy dots, like everywhere you look, and also they're all like moving too and like kind of like dancing around. So you're just thinking like, dude, what is going on with me? This is seriously bad. I thought I had like permanently messed myself up from something one way or another. I was like, man, I'm shot, dude. I'm so out of luck. That's all gone now. As I treated and learned more, like I was able to get rid of like almost all these symptoms. So that's what I want to say about that. I'm going to link all the articles I've read to you guys in the description, and then I encourage you to keep researching this topic because it's very, very misunderstood. Very misunderstood because it's very, very complicated. And also there's a lot of people that kind of like don't want you to know that this whole thing is going on. It's a huge epidemic. Like I talked earlier in one of my other videos, how many cases per year of Lyme disease are occurring in the United States alone, let alone worldwide. And so they're going to be responsible for a lot of these other problems that we're seeing in the world. And I believe this and more, the other tick-borne infections that are even more stealthy, so better at evading the immune system and better at evading detection in lab work, are going to be responsible for a large source of America's mental health crisis. And I really do believe that, especially when I think back to like everything I've gone through and realizing that if I wasn't more curious and had like a good head on my shoulders where I'm just like, you know what, I'm not just gonna believe anything I'm told. I'm gonna like research this for like a long time, all over the internet, everywhere, read books, see plenty of doctors, get the lowdown, whatever. I'll say I turned researching this into like a full-time job, especially during the lockdown, right? I had nothing to do. I was also very scared that like my disease progression would make dealing with something like the coronavirus. Very, very difficult. So I was really scared during the pandemic, right? Excuse me. And so yeah, so I basically was like, I need to figure this out because maybe I'll die. And so spent a lot of time doing that, and these are the outcomes I've come to, especially when you read more and more from people that are very knowledgeable in the area, have been doing this for a long time, see tons of patients, and that kind of thing. So next time I have an appointment with that doctor, I may ask him if it's cool if I ask him some questions to, or maybe even like interview him basically, so that I can show that to you guys. And I'm extremely fortunate to have this doctor. He's like one of the best in the world at treating this type of thing. So if I could get him to share some knowledge with you guys and answer some of the questions I have, now that I know he's like publishing stuff on PubMed and all over the place, I'll bring that to you guys. Free, of course. I do this out of the goodness of my heart. And I hope this will lead maybe the conversation and movement around this stuff to a better place, so that maybe one day, like this little effort that I'm putting in could lead back to, funding for this and more research, and possibly then I could be like healed one day and not sick anymore. And so that would be amazing. So that's not really like my main purpose, but like if that happened as like an offshoot from this, like I wouldn't complain. So I'll see you guys in the next one. I hope you're learning, and I hope this has all been very informative. Please remember to like and subscribe, and I'll see you later.